We are live.
Great. Hey, everybody. Happy Tuesday. This is Ariel Ford, Director for the Division of Child Development. Here with me today, I have the ever amazing Christy Snug. Christy, you want to give everybody a wave? And we are going to present to you the COVID-19 vaccine training. So it was important for us as the department began to roll out the COVID vaccine response that we provided a chance for you to see the training that will be presented across the state to various stakeholder groups, to our child care providers, and that you have kind of a first look at it so that as providers are getting this training, you know what they are expecting, you know the information that we have, and this is going to be updated every week. So we will be giving the FAQs and documents are updated every week. So we're so glad that so many of you could join us today. This is being recorded, so it will be on the our YouTube channel, so people who couldn't be here today will have a chance to view it. Christy and I are going to co-present, and Madhu will be working with us on the chat. She's trying to get in, having some technical difficulties, so thank you for being patient in the first minutes. So this training is really about the science of the vaccination. The distribution plan that we have to date is still being worked on to some extent, so there'll be more information about that to come. And we do want to make sure that there's time for questions and answers. Please feel free to use the chat box. We will try to answer as many as we can, and then the ones that we can't answer, we will provide an email back to the division so that we are able to answer all of those, if not today, another day. So here's the good news. After months and months, we are at a place where we have a safe vaccination that will help protect you from getting COVID-19. The vaccine is free to everyone, and we want to go over and review what you need to know about the vaccine moving forward. So here's what we'll start with. These are the key points to take away. First is that this vaccine is safe and effective. COVID-19 vaccines are going to help us get back in control of our lives and back to the people and places that we love. The scientists had a head start, so while it felt like this was a really fast vaccination development process, scientists were using information that has been gathered over years and decades. Thousands and thousands of volunteers helped with clinical trials. They are safe, and you cannot get COVID-19 from the vaccine. We do have a limited supply of the vaccine, so those who are most at risk are going to get it first. And our tagline is, you have a spot, so take your shot.
So I'm going to jump in here. Ariel, thank you for doing my slides.
I am so sorry. I just realized I had a big K on it. Sorry, Christy.
No problem. So what we're going to do is we're going to dive a bit more into each of these key points that Ariel just covered. And we want to start with the first one, which is scientists had a head start. They have been working on this vaccine and building on decades of work to develop vaccines to similar viruses, including those like SARS that I'm sure many of you have heard about and have talked through in the past. So these first two vaccines that were created by Pfizer and Moderna, these vaccines use a method that researchers have been studying and working on for decades. These vaccines use the mRNA technology, and we'll talk more about that in just a few minutes. But the bottom line is that I know there's a lot of concern out there on the street about people saying, you know, this vaccine was rushed through the process. It hasn't really had time to for it to see how it's going to react with people. But they have been studying this vaccine for decades, and they have built on previous knowledge that they have learned from these other types of similar viruses. So the vaccines that we have are tested, they are safe, and they are effective. They have been rigorously tested for safety and effectiveness. They've been through the same clinical trial steps as other vaccines and drugs that the FDA approves. And you need to understand that and make sure that other folks understand that, because I've heard a lot of feedback from folks that this didn't go through the regular process. It did. It was just that we had the head start. A lot of the work had been done, and it did go through these same safety protocols, and it has been rigorously tested. More than 70,000 people volunteered for the clinical trials for these two vaccines, and they wanted to, and we're excited about that because that helped us to make sure that these vaccines were safe, and it also shows that they prevent the spread of COVID-19. To date, the vaccines are 95% effective. I'm sure you've heard that. Both vaccines are 95% effective in preventing COVID-19. And this is actually higher than and more effective than most scientists ever dreamed of or hoped for. And it's more effective and higher than other vaccines have been in the past. We've also found that there have been no serious safety concerns in the clinical trials with either of the vaccines. So whether when it's your turn to get yours, if you get the Pfizer or the Moderna, both are proven very safe. The only thing that we've really heard about is that there can be some temporary reactions, like a sore arm for a day or two, or feeling a little tired or achy. This could be similar to what you might experience if you've had a shingles vaccine. But what you need to remember, as this last point bullet on the slide says, is that these are temporary reactions, and they'll go away in a day or two. They are not dangerous, and the good news is that by feeling those, you know the vaccine is working the way it's supposed to be working. And then one other piece that I would just mention is that I know there's been a lot of concerns with folks that might have allergies. What we have been told is anyone who has had serious allergic reaction to any vaccine or medicine that is injected should talk about these risks and benefits with their doctor. So you can always reach out to your health professional for that. But anybody that has allergies to food and animals or environmental things such as pollen or medications, those folks should continue to get the vaccine. But if you have concerns, you can always reach out to your medical provider to discuss that further. Move on to the next slide for me, Ariel. There has been an intentional effort to recruit volunteers in this process from historically marginalized populations. Now, when we say historically marginalized populations, we're really talking about populations that have been hardest hit by COVID-19. And I think you all are very aware that that includes our African-American populations and our Hispanic Latinx populations. This pie chart on this slide actually shows that the people, the racial and ethnic backgrounds of the people that have volunteered for the vaccine trials. And our historically marginalized populations, even though they're less than the white population, they are a better represented in these vaccine trials than in most clinical trials. And we are that was an intentional purpose because of how the vaccine is affecting those populations.
So another important thing for us to reiterate is just that you cannot get COVID-19 from this vaccine. The vaccines work by increasing your body's natural ability to fight the virus before the virus attacks you. So the Pfizer and Moderna vaccines work kind of how you see in the slide below. So the vaccines imitate COVID without giving it to you. And after you get the vaccines give your body instructions for how to make a protein that safely teaches your body how to make the antibody to fight the real COVID-19. Your body naturally breaks down or destroys the protein from the vaccine. This you'll sometimes hear called the spike protein in the news and other releases. And with these antibodies, you can fight off the real virus if it tries to attack you. Another thing that we want to just make sure everybody's hearing, because there's been a lot of back and forth in the news about this, is just that 2 shots are necessary, and we do have a plan in North Carolina to help everyone get both doses. So the Pfizer and Moderna vaccine require 2 shots to build up a strong immunity against COVID-19. The second shot comes 3 or 4 weeks after the first. So the Pfizer is 3 weeks and Moderna is 4 weeks. And it's really important that you get both doses of the same vaccine. So for example, you should not get the Pfizer first and get a Moderna second. It should be the same, Pfizer and then Pfizer, or Moderna and then Moderna. So we built a system, the North Carolina COVID-19 Vaccine Management System, and that's going to help people make sure that they are getting the right second dose at the right time. In order to be fully protected, you do want those 2 doses, and that's why our state is continuing with the 2-dose strategy. 1 dose was just not found to be as strong a protection and not strong enough to fight off COVID long term. So that's why 2 doses were tested and recommended. Your privacy and your personal information, we know this is a concern. It's a concern for us, and they are protected at all times. So nothing in the vaccine can be tracked. The protein that your body makes cannot be tracked. It disappears after it makes your immune system stronger, and your personal information about your vaccine and your health are protected at all times. We do not send any personal information to the CDC. North Carolina doesn't actually require an identification card like a driver's license or something like that to be vaccinated. Some employers or some healthcare providers might ask for an ID when limited vaccine has to be prioritized, but that is not a state requirement at this point. We also want you to know that vaccines are going to be free and available to everyone. At first, like we're seeing now, the supply is pretty limited. And so there is prioritization at the beginning. But the Pfizer and Moderna vaccines have been authorized and sent to all of the states. It is going to be some time before there is widespread availability for everyone. And so the state and federal public health experts are recommending that the best way to fight COVID-19 is to start vaccines with those who will be helping to spread vaccines aimed at helping to slow the spread and to save lives. The vaccines are free, even if you don't have health insurance. So that's really important for our child care providers to understand. Even if they don't have health insurance, this vaccine is free for them. We've gotten questions about whether people will have to pay a copay for the vaccine. What we know is that Medicare and Medicaid will be covering both the cost of going to the doctor and paying for the vaccine. We do not know if Blue Cross Blue Shield of North Carolina or others will be charging anything to their members, but we expect that most commercial health insurance companies will also be covering the administration fee if there is one charged to the provider. Please rest assured that you have a spot and you should take your shot.
So this is one of our resources that is available on the website that Ariel had just shared. Because we have a limited supply of the vaccine, North Carolina is prioritizing COVID-19 vaccinations. And as you would expect, the most at-risk people will get the vaccine first. But please rest assured, there will be vaccines available for everyone. It's just that our supplies are limited right now, and they'll continue to be limited over the next several months. But as we move into the spring of the year, they will become more readily available. So everyone will get a chance to get their vaccine. It's just that we had to prioritize how we were going to roll the vaccinations out in North Carolina. Very similar to other states, we're making them available in phases, and we created these phases based on the CDC guidance and other medical providers, state and federal public health and advisory groups as to how we might prioritize. So if you look at this real quickly, the purple area, which is phase 1A, We started in mid-December. We're still here. This is the area, like I said, in purple. This is where we're vaccinating our healthcare workers who are on the front lines fighting COVID, those that are caring for the patients, but also workers who are cleaning those rooms. And also this would be our long-term care staff, that our long-term facilities that have residents living there, like many of our nursing homes, where we know that where the virus was spread rapidly as it emerged here in North Carolina and across the United States. Then, once we get through that, and most of those folks are already, those that have been vaccinated or are getting their second doses, then we're going to move in, and I think you're aware that we moved into 1B a couple of places last week in North Carolina, but most places began this week. With 1B, this is the area in blue on this chart. These vaccinations, because of the limited supply, will be given in groups. So group 1 is anyone who's 75 years or older, regardless of their health status or their living situation. So you have heard, I'm sure, and seen on the news all the long lines of these 75-year-olds throughout North Carolina who are lined up to get their vaccine. That's group 1. And then group 2 are those healthcare workers and frontline essential workers who were not vaccinated in phase 1A and who are 50 years and older. And then group 3 is to continue with those healthcare workers and those frontline essential workers of any age. Now, when we talk about frontline, I think that's pretty obvious. But when we talk about essential workers, I do want to give you some examples of some of those folks. Firefighters, grocery store workers, teachers, and child care providers are considered essential workers under 1B. So we are very excited. It will depend on age. We'll do the 50-year-olds first, and then group 3 will be the rest of our child care population. So just wanted to make sure you understood that. There's probably a question that some of you may have in your mind about how are we going to get those out to the child care providers? What does that distribution plan look like? All of those types of things. We are still finalizing that distribution plan, and we will get that out just as quickly as possible. That is a priority for the department right now. And as we said, it's changing on a daily basis. We'll get that information out to you as quickly as possible, but that is being finalized as we speak. And then as we move, you'll see a group 2 or phase 2, which is there, and then phase 3 and phase 4. Phase 2, real quickly, the green, we also, you can see the groups are identified. Again, that's because as the vaccine becomes more readily available, we're prioritizing by groups. I'm not going to read all of those to you. There is detailed information on the website, Your Spot, Your Shot, that you can go and read in more detail about those. I will call to your attention, though, that K-12 students are in group 3, age 16 and K-12 students, age 16 and over, and then younger children will only be vaccinated when the vaccine is approved for them. So eventually, probably most of us are going to fall, not all, but many of us will fall in phase 4. But it is coming, and this is just the prioritization. Again, we're prioritizing those that are most at risk first. You may say, well, I want to know what's going to happen when we get to phase 4 and when am I going to get my vaccine? And the answer is we don't know that yet, but we're working on those protocols, and we'll get those out as soon as we can. Much of it will depend on how much vaccine we receive from the federal government. And right now, we are getting those vaccines on a weekly basis, and the federal government is determining how much we get based on state population and things of that nature. So all of those details are not worked out, but we are working through them. Let's move on to the next slide. We know people are very curious. A lot of this I just covered about what's happening right now with the COVID-19 vaccinations in North Carolina, who are getting them, and so forth. So as I just shared with you, our healthcare workers who are at the highest risk for exposure, doctors and nurses, and those that are cleaning those areas are in the process of getting their 2 doses. Most of them have already gotten their 2nd dose. Long-term staff and residents, people living and working in places like skilled nursing homes or group homes are getting theirs. Healthcare workers are being vaccinated in local hospitals and health departments that have received early shipments of the vaccine. Again, much of this is controlled by the federal government and how the vaccines are being distributed. Those that are in most of our long-term care facilities, that is being managed by the federal government. And you may have heard of the Pharmacy Partnership for Long-Term Care program, where CVS and Walgreens are vaccinating in our long-term care facilities. Please understand that is a program that they're working directly with the federal government to vaccinate those residents and staff. You cannot go right now to your local CVS or Walgreens and get the vaccine. Maybe eventually we'll get there, but we're not there yet. So right now, beginning this week, in most of North Carolina, COVID-19 vaccinations are available to people 75 years or older. Again, I want to emphasize, if you have a family member, a parent, or someone who is wanting to get these vaccines, the vaccines are still very limited. Most of them need appointments to get them. There's long lines, but you just really need to understand that supplies are limited, but we're getting more as we move forward. Most of the places you're going to need an appointment to get vaccinated. And the best place to really sort of find out where you might be able to go is to contact your local health department. They can help you with identifying where you might be able to get vaccinated. Most doctors' offices do not have the vaccines available yet, so if your primary health care provider probably is not doing that. But you can visit the North Carolina vaccine website to find out which health departments and even hospitals are giving vaccines in your area. And you can search by zip code or by county to find those locations and all the contact information. And then one other thing that I would just mention is there's a number on the right-hand side in the light blue on this slide. Last week, Governor Cooper mentioned that we had a COVID-19 line, and this line is being staffed. It's a free call, and you can call. It's managed by a community care of North Carolina, and they can help push up or give you information about where the vaccine might be available and where, based on your age and what phase we're in, you could get that vaccine. Let's move on to the next slide.
Christy, could you just jump in real quick if you go back to that slide? I just want to emphasize to folks, our local health departments and hospitals, as you may imagine, are probably receiving the highest call volume they've ever experienced. So we are asking folks, if you're not in 1A or the 1B group 1, please don't call them at this time unless you're trying to help a loved one who does meet that phase, because they are just swamped trying to answer calls. What we do ask is, if you're trying to get more information about the vaccine in your county, that you visit our website, yourspotyourshot.nc.gov, because we have a list of the vaccine locations, their website. A lot of them are updating information on their Facebook page, because that's a really fast way to get information. So we're asking folks to be patient, and if it is actually your time, that, please reach out, try to schedule an appointment, and many of their websites are starting to update on how you can do that. But we're asking folks, if you're not part of the groups that are getting vaccinated right now, please hold, because they are trying to manage a lot right now. And we're asking folks to be patient, because we know there is limited supply and that these folks are working as hard as they possibly can to get vaccine to people. So just wanted to add that note.
Thank you, Madhu. And again, if you would use that resource, which is also available on that website, that shows the colors that we went through as to what phase we're in. Remember, we're just beginning phase 1B. We're still finishing phase 1A. And as Madhu has said, if you do not file or not helping someone who files in one of those two, do not reach out to those health departments right now, but try to go to the website and get as much information. All right. Thank you, Madhu. Also, just wanted to reemphasize this, that North Carolina receives shipments of the COVID vaccine each week. The federal government is deciding how much of the vaccine each state gets based on the state's population and the need. And therefore, you just need to be aware that we don't really have control of getting that out any faster. The federal government is controlling that. Once it comes to the state, the North Carolina Department of Health and Human Services then determines which vaccine providers, like our local health departments or hospitals or clinics, which one of those will receive the vaccine doses. And it's based on their ability to reach those prioritized populations that we've already talked about, such as our healthcare workers and our long-term facility workers. The manufacturer then ships the vaccines and the vaccination supply kits to the local vaccine providers in North Carolina. So they're coming directly from the manufacturer. And then North Carolina is working closely with providers that are receiving the vaccines to make sure that they're safely stored and handled, especially the Pfizer vaccine, which requires the really, really cold temperatures or frozen storage. And then vaccines become available first in hospitals and local health departments, and as we've shared, in those long-term facilities. And then they'll be in other settings like clinics. Eventually, they'll be in doctors' offices, but that will come later as we move into the different phases.
So we've talked a lot about the phases, but how do you know when it's your turn or the turn for a loved one and when you can get your shot? So as we've talked about right now, it's healthcare workers, long-term care staff, and residents, and adults 75 and older are the first priorities. And so I think what's important for our field is not just that we are supporting our loved ones, but that our child care providers have contact with so many families who might have a loved one who is 75 or older, who might have someone in their family who is a healthcare provider. And so we want to make sure that our child care system is aware of the phasing, is able to answer some of the immediate questions that families might have. We are not asking them or expecting them to be healthcare providers, but that they know where to point people to information and generally know what phase we might be in. So that's where we are right now. There is a wait for the vaccine, but adults 75 and older are going to be at the front of the line for this. And as I said before, they should be contacting their health department or hospital if they have questions. But as Madhu said, please encourage that we are contacting our health departments and hospitals when it is folks who really are in these first couple of phases because of the volume that they are experiencing right now. So we are hoping that very soon health departments and hospitals will be doing vaccinations for older adults 75 older and jobs and people who are in jobs that make them at a higher risk for getting COVID-19. So that is the next phase of rollout. And we always want to encourage you and the people that you're talking to refer back to yourspot.yourshot.nc.gov. That's going to be the most up-to-date information. The website is being updated regularly with clear and concise information about what is happening with the rollout. Guys, I love seeing y'all's questions coming into the chat, so keep them covering. And then primary care physicians do not currently have the vaccine. So that's another thing that I think has been talked about here and there and we've heard about maybe on Facebook, but primary care are not vaccinating as of right now. So those who do not have an employer or a residence facility that is providing the vaccine should contact the health department or the hospital if it's your phase. We're working really hard to keep North Carolinians informed so that they can take their shot for COVID-19. And this takes all of us. So, not one of us is going to be able to get the information out all by ourselves. It takes all of us being ambassadors for this information. Please look for news conferences that the governor and Secretary Cohen are giving. The Secretary provides up-to-date information twice a week. The website, social media, and trusted community members such as the health departments are great places to look. Community leaders and organizations are helping to shape this campaign as we reach out. So that's you guys. You are ambassadors for this. You are helping to shape how the rollout happens in North Carolina, how North Carolina receives information about the vaccine. And the goal really is to provide all North Carolinians with a spot for honest information and updates, truthful information, and information about where they can get their shot. Another thing that has been, Christy talked about in a previous slide that I think it's really important that we reiterate is that we know that racism runs throughout our social, economic, healthcare systems, causing unequal access to care, causing maltreatment and neglect for historically marginalized communities. These long-standing and continued racial and ethnic injustices in our healthcare system have contributed to the lack of trust in vaccines. North Carolina is drawing upon experience and expertise of leaders from historically marginalized communities to help develop and implement its vaccine plan. This is not something that the state is shying away from. We want to acknowledge honestly that this is a valid and real concern in many communities, and to begin to build the trust of these communities around the COVID-19 vaccine.
So there are many leading medical and professional organizations that are encouraging Americans to get vaccinated. On this slide, you'll see many of those, like the CDC, the NAACP, the American Hospital Association, American Nurses, American Medical Association, and on and so forth. So we are really, really encouraging Americans to get vaccinated. All these health providers are doing it as well. And as we've already shared, many of the concerns that people have, some of them, hopefully this will give you the information that when you hear these questions, you can share that as well, and that folks are being encouraged to get vaccinated. If we can go on to the next slide. We've talked about many of the resources. We've emphasized over and over again that there is a COVID vaccine website where you can find the most up-to-date information. I have to commend the department for keeping their websites up and updated, and they're updated on a daily basis, probably multiple times a day. Please go to yourspotyourshot.nc.gov if you haven't. On that particular website, we are, as I said, adjusting our plans and materials as we learn new things every day from the federal government and as we learn more about the vaccine. I do want to point out just a few of the things that I think might be useful for you as you go to the website to look for. The first one is this one-page flyer on COVID-19 vaccines to distribute. This is a one-page flyer that really hits the highlights of what we talked about today in this presentation. It's something that you might want to print off and have, and you can share with your networks and maybe even some of your colleagues or even some of your family members who have questions. We also have a great list of frequently asked questions. Probably some of the ones that we'll address today are also answered on those frequently asked questions. So please utilize that. They're updated at least weekly, if not more. And the deck that we're using is there as well if you would like that. It is being constantly updated as we get new information, as we move through the prioritization that we talked about earlier. And then we also have the graphic that I talked about with the prioritization listed. If you want a copy of that, it is available on the website. And there's also videos, public service announcements from some folks that you may recognize. I see our fearless leader, Dr. Mandy Cohen there, and others from the department and others from across the state of trusted individuals that are really sharing the message that we want folks to get vaccinated. So please use this website. Again, it's yourspotyourshot.nc.gov. It has many of the resources that we've talked about and some resources that you can use to share with others. So while I think, Ariel, I'm just going to jump in this one and then we'll finish. I'll give it back to you. But while we're waiting for our spot to take our shot, in the meantime, we cannot not practice the 3 W's. We've shared that the vaccines are here. They're being distributed, but we don't have enough. And even if we had enough, it's going to take time for everyone to get in those lines and get their shot. So the best thing that we can do in the meantime is to continue to practice the 3 W's, to wear, wait, and wash. Getting the COVID-19 vaccine and following the 3 W's is everyone's best protection from getting and spreading COVID-19. I'm so excited that we are seeing that vaccinations are underway. I think that gives us hope for 2021. We've had a hard 2020. I know for you guys and for everyone else, I am really excited about 2021. But right now, the virus is still very, very much out there. It is extremely contagious and it is deadly, and we need to persevere for a few more months until we can get everyone vaccinated to make sure that we continue using the 3 W's, limit our social gatherings until people have been vaccinated, and then we can hopefully get back in control, get back to our family and friends, and get back to kids being in school. But the COVID-19 vaccine and the 3 W's, if we do that, we can get there quicker and we can get there in a much safer manner.
And so now what we are asking of you is that you are helping to share this information with people in your community. And so for us in our work lives with our childcare community, our partner agencies, and then I think all of us are having these conversations with our loved ones and our community, our private communities too. So please help direct people to know where to find reliable information. You have a lot of websites and places to direct people now, yourspot.nc.gov, and the CDC website. So there's a ton of places that they have reliable, great information to go and find the answers to some of their questions. We ask that you show that you have trust in the safety and the effectiveness of this vaccine. It is science-based, it is safe, it is effective, and we really want to get that message out to our whole community. These are unprecedented times. I don't know how many times we've said that over the last year, but it remains true. And people are looking for community leaders like you, people who have the best intentions for our state at heart, the best intentions for our communities at heart, to get information that is safe and reliable about this vaccine. We ask that you are an ambassador for the safety and the effectiveness of this vaccine. And please share the COVID vaccine and communications materials as they become up to date. We ask that you just kind of bookmark those, look at them regularly, share them with people in your community, share them with our childcare providers, and you can find those on the website, yourspotyourshot.nc.gov. Several of you have been asking questions in the comments, but we want to continue to answer any of those questions. And if you have a need to say it, if it's just easier to try and talk it out, you can raise your hand and let you know we'll help get you unmuted so that you can ask questions. But there have been several questions asked and answered, and we'll Sarah and Madhu have been
I can
trying to
try to take a few. Yeah, let me try to take a few that I see in the chat. One of them was about somebody who was over 75 went to get the shot. They thought they had to pay, and because of that, they decided not to take it. Now that they know it's free, are they able to go back? So yes, we kind of are describing it to people as like the phases are kind of like airline boarding. So like once your group is called, you can go at any time. So if you were in 1A and you were a healthcare worker and you weren't sure, or if you're in the 1B group 1, you're over 75, you weren't sure, but you are ready now, you can go at any time. You will not lose your spot. So yes, the answer to that is you can go back and that person can get their shot. I think there was a question about allergic reactions, and I think Christy covered it in the presentation, but I'll just mention it again. So if there are folks who have had severe allergic reactions like anaphylaxis to ingredients that are in the Pfizer and Moderna vaccine, then they should not get that vaccine. We're recommending, if you are a person who has had severe allergic reactions in the past, talk to your doctor about whether it is right for you. But I think, as Christy said, you know, food allergies like a peanut allergy or pollen, that would not be a reason to not get the COVID-19 vaccine. But it's those severe allergic reactions. And I do want to note that the severe allergic reactions to the vaccines have been very, very rare, and they've mostly occurred in people who have had previous severe allergic reactions. And in fact, when you get your vaccine, the person who's giving you the vaccine, they will watch you for 15 to 30 minutes after the vaccination to ensure your safety. But again, it's really mostly if you are someone who has had a severe allergic reaction in the past that you should be concerned and talk to your doctor about whether it's right for you. There's a question about, you know, many of us make visits to childcare facilities. Would we be considered in the group with childcare staff? So the department's leadership team right now is working very hard to provide more guidance on what it means to be a frontline essential worker. And again, we are not at that group yet. We're still in the healthcare workers in long-term care and folks who are over 75. The next group will be the frontline essential workers who are over 50, and we hope to have more information soon about to provide more information about who is in that group, because the CDC provided those initial categories, but you know, we're hoping to provide a bit more guidance on that. Can children get vaccinated? At this time, no. The clinical trials have not been done in children. The Pfizer trials were done in children 16 and up. So those teenagers 16 and up can get the Pfizer vaccine. I know that there are clinical trials underway for ages 12 to 15. I'm not sure about younger than that. That's something we can find out. That's a good question I don't have the answer to. So let's see.
Madhu, one of the questions is about, is there a requirement for essential workers to be vaccinated?
So no, there will not be a mandate. We don't have a plan to require people to get vaccinated. It's possible, though, that some employers or schools may require the vaccine for their employees or students, but North Carolina will not, the state will not be mandating it.
I think maybe would it be appropriate for people who are concerned about that to talk to their HR department just to find out where their company individually is?
Yep. I think that's a great suggestion.
It might be from the standpoint, too, though, of if you are an essential worker, are they mandated to get it? If you're going to have to come in contact with essential workers, you may worry about it yourself. But that's why you continue to practice the 3 W's, and you protect yourself by being vaccinated, and then, you know, you don't have to worry about it on the other side.
There was a question about if an older person takes blood thinners, should they take the shot? I would say for clinical questions like that, if somebody has a specific question about, a clinical condition they may have, a medical condition, that they should talk to their doctor and just confirm, my medical profile. Do you have any concerns about me taking the shot? I would say that's the best approach to go if folks have questions about their medical history.
We have a few more minutes, and I really want y'all to feel like you can ask any questions as we have a few more minutes before the end of our time together. We don't want you to feel like any question is too small or too big or too scary to ask. It's important that we feel comfortable asking questions. And as Madhu said, if there's something that's more appropriate to be answered by your own physician, we'll just say that. But you're going to be getting a lot of questions about this, and so we want to arm you with as much information as we can. So please keep the questions coming. We've got a few more minutes left, and we'd love to answer them for you. Will the vaccine be needed annually like the flu shot?
So I don't think we know yet. I know that scientists are monitoring that. It's possible that it could be like that, but this is something that as we gather more data and the longer people have been vaccinated, we'll know more. But I don't think we know that yet, if it will be a annual like the flu shot.
And again, just to reemphasize, for our field and home-based staff that are making visits, we have not completely identified essential workers yet, and we will be getting back to you on that as the department further defines those essential workers, correct?
That's correct. Yeah, right now the CDC has offered those kind of broad categories of how they define frontline essential workers, including education, which they have included teachers and childcare. And the department is working to provide more guidance on more details about what that means. What does it mean to be an essential worker? That has not come out yet, but as Christy said, as soon as that information does, you will hear about it.
And again, excuse me, Ariel, but if you will continue to practice the 3 W's, you are doing everything you can do to prevent the spread of COVID-19.
And then importantly for this group to know, we are working with our child care health consultants, and so we will be getting them trained on this training because they are trusted health information hubs for our state child care providers. We want them to have all of this knowledge and to be able to answer questions, be able to provide the training for our child care providers and other affiliated groups so that they know where to get information, so that the child care health consultants are on the same page as all of the rest of us. So please don't feel like you're going to have to go and do this training. We just wanted you to have it ahead of time, but we are working with the CCHCs to make sure that they can provide this training for our child care provider community, centers, homes, et cetera. Madhu has done a wonderful job of trying to coordinate all of these trainings, so I just want to give a public acknowledgement of the hard work that she has done, and amazing thanks for all of the effort that she has put into keeping our state safe, to supporting the department in getting this information out. So thank you so much for that, Madhu.
Thanks, Ariel.
Appreciate you.
I'll answer another question I see. Will people who have had the COVID-19 virus and recovered have to get the vaccine? So yes, it is recommended that even if you already had COVID-19 and you've recovered, you should get the COVID-19 vaccine. And the reason for that is that it protects you against future infection. And especially because of the severe health risks that we know, especially for folks who are older or have chronic medical conditions, and the fact that reinfection is possible, that is the reason why the CDC recommends that people get the COVID-19 vaccine even if they have had the virus in the past. at this time, we don't know how long someone is protected from getting sick again after recovering from COVID-19. That immunity that you get from having an infection, which is called natural immunity, varies from person to person. And some of the early evidence suggests that that natural immunity may not last very long. So again, a reason for getting the vaccination when it's your turn. And people have asked, how long do we think the vaccine will protect you from COVID-19? At this time, we're looking at what we learned from the clinical trials. So we know that it will provide protection for at least 2 months. We think it will be longer, and we're hopeful it will be longer. And that's something that scientists are continuing to monitor. As millions of Americans have already been getting vaccinated since December, they will be monitoring this question of how long does the vaccine protect you, and we'll be learning a lot more. But we do know that it will be providing that protection for at least 2 months, and we hope longer. Somebody asked, who is Madhu? I'm sorry that we didn't cover that. My name is Madhu Volamiri. Sorry for not introducing myself earlier. I had some technical difficulties getting on. I work in the Office of the Secretary as a Senior Strategy Advisor and have been working on the COVID-19 response since March with Christy Snuggs. And so I work for DHHS, and in the last month and a half, my life has become all things vaccine. I'm working a lot on trying to train folks, as Ariel said, in the department as well as outside, to be able to speak to folks and educate people about the vaccine and why it's important. So that's who I am. Sorry we didn't introduce me.
And I will just add, Madhu, that Madhu works very closely with Dr. Cohen, as well as Betsy Tilson, our state health director, and all of our epidemiologists and all of the highest and most educated folks in the state of North Carolina around the COVID-19 response. And she probably knows this information inside and out even better than they do in some cases. So I can 100% vouch for her validity and reliability. She is awesome.
Thanks, Christy. So Ariel and Christy, if folks still have questions that didn't get answered, I can of course help get those answers, but I didn't know if you had thoughts on how how folks should send them.
It's a great question to do.
I think probably, Ariel, I would suggest they send them to us, and we would get them at this point. What do you think?
Yeah, I think if you send them to Ariel and Christy and copy Tracy, I know that seems like
that's a great idea.
But I don't want somebody to have a question that's really important and it slips through the cracks of our email. So between the three of us, we'll make sure that we are getting responses to you. And like I said, no question is too small, no question is too big. We want you to have all the information that you need to feel confident being ambassadors for this really important vaccine as we move out into the community and as we move through the phases. So we are a minute over time. I am so grateful that you spent an hour of your week learning about the vaccine alongside us. We'll continue to get information to you as it's updated at the department level and the state level. But we're on the downhill slide, guys. We're going to make it through the vaccine this year. We are going to get it rolled out, and we are going to have a safe and healthy year. So until then, keep wearing your masks, keep washing your hands, keep keeping yourself and your community safe. And I'm really proud to work alongside you. And just thank you to all of you who are working on behalf of our kids and families in the state. Without further ado, Christy, do you have any closing remarks before people start to hop off?
The only thing, and did Madhu hop off already?
I think so.
There's a question about whether or not DCDEE will mandate the vaccine or DHHS. At this time, there is not any requirement from our department or division for mandating the vaccine. So I do not think that will happen that I'm aware of. Are you, Ariel? Is that, yeah.
No,
I just wanted to make sure, Jackie, we got that question answered.
Sorry, good. So if you have further questions, email Ariel, Christy, and Tracy Hip, and we will make sure that between the three of us, we compile those and get them answered for you so that nobody is left without the information they need and want. And thank you again, guys. Go and enjoy the rest of your day. It's a little bit sunny here in Raleigh, so I hope where you are it's a nice day too. And we will talk very soon. All right. Thank you so much. Be well. Stay safe.